Good evening, everyone. I am Dr. Renee, and once again, we're here at blackdoctor.org. Tonight, we have a really great discussion. Why do Black people get asthma? And this one is really near and dear to me because, as you guys know, because you watch all the time, I'm sure you know that I am a severe asthmatic. So I am very excited to introduce my guest, Dr. Michael LeNoir. Good evening.
Good evening, Renee. How are you?
I am well. Can you please tell us one, where are you coming from? Where are you coming to us from this evening?
I'm coming from you from the San Francisco Bay Area.
Okay.
Well, I'm not only staying in place, but I'm standing in place. So, but from San Francisco and Oakland is where I'm calling from.
Okay, awesome. Thank you so much. As you guys know, you need to hold on, I'm gonna throw it up here for you, but you guys need to start a watch party. If you have questions, put them in the comments, and I will do my best to try and read them and see as many as we can and answer as many as we can. But I know this is going to be a great discussion because, like I said, it's near and dear to me. So it's going to be great. So let's get right in. Exactly what is asthma?
Well, asthma is what we call inflammatory disease of the lung. That means that there are cells that come into the lung often to protect you, different kinds of cells. But as a byproduct, they release chemicals. Those chemicals force the airway to close down and force increased mucus production and cellular infiltration. So it's really an inflammatory process in the lung.
Okay. So asthma appears in different forms because I know a lot of people seen these commercials with the eosinophilic asthma, and then there's the exercise induced. So can you explain some of that?
Yeah, asthma is a disease characterized by what we call a lot of different phenotypes. Certainly, there may be 7 or 8, but certainly the most common one is the ones that we see with patients who have allergic diseases, and that's one phenotype. We see children who have asthma only with infection as infants, and they outgrow that process. That's another type of asthma. We have severe intractable asthma, people who won't respond to medication. So there's several different types depending upon the nature of the presentation, but all of them are characterized by the same pathophysiologic change, which is to have the airway closed down and to have a much increased mucus production with the obvious clinical manifestations of shortness of breath and under very significant circumstances, there's wheezing.
Definitely, yes. So there is, a lot of people I think are walking around with asthma and don't know it for a long, long time, which I think is a little crazy. But and they often think they just have bronchitis. Can you explain that?
Yes, I think that people don't recognize that probably the most common symptom of asthma is coughing. And different from other diseases like bronchitis or chronic obstructive pulmonary disease, asthma is reversible. And so that means that if you give a patient a bronchodilator like albuterol or any one of the albuterol named products, then you expect that airway to open up quickly, or relatively quickly. So asthma separates from chronic obstructive lung disease or even acute bronchitis when it is acute, or chronic bronchitis is a reversible problem. That is because it's primarily a disease of smooth muscle, so that when you take the medicines open up the smooth muscle. Whereas diseases like chronic obstructive lung disease or bronchitis are diseases where there's destruction of the lining of the lung, which prevents you from moving air across the airway. So the difference is between those two diseases is reversibility.
Okay, so bronchitis is reversible and asthma is irreversible.
Bronchitis is not reversible.
Not reversible. Okay.
Asthma is reversible.
Got it. Okay. I have to make sure I got that. Okay, so so now a lot of people feel like, well, one, we do know asthma often comes from where you live, sometimes has a lot to do with if you get asthma or not. So can you explain that? I actually talked about that in an article in Ebony Magazine once. So if you can explain that. And that is probably why Black people get asthma. So go ahead.
Well, there are basically two general components that contribute to who has asthma and how significant that asthma is. One, there's a number of genetic components which we've studied published in a number of different articles, and the other, they're the social determinants of health. Certainly where you live makes a big difference. What you eat makes a difference. Whether you can exercise also makes a difference. It also makes a difference if you live close to polluted plants and chemical factories. And as African Americans, we tend to live in those neighborhoods. They tend to put stuff in our neighborhoods that aggravates asthma. So while pollutants, you're not allergic to pollutants, things like air pollution, infections, changes in weather, those things can irritate the airway in patients who already have asthma. So those are two dynamics. They're called the social determinants. And then there is two other dynamics which aren't talked about as often. One is the impact of racism on how asthmatics are treated, and the stress of just being Black in America can weigh on asthma patients in definable ways, ways that can be measured. And then finally, there's the unconscious bias that every Black person faces when they go into the healthcare system. They face it because they're Black. They don't get the same drugs. They don't get the same treatments. They don't get the same visits. They don't get the same attention. And when there's a certain bias that a lot of doctors have, primarily, well, not Black, about what Black people are and what Black people mean and what Black people need. And it's resulted in poor outcomes simply based upon being Black. And asthma is no different from any other chronic disease in that regard.
Now, you touched on it a little bit. I wanted you to talk about the genetics. I am a descendant of asthmatics. So, it wasn't just me, it was my mom. And then it was before that her uncle. And so I know in our family, we have asthma. So is there more genetics than social determinants? You said you did study the genetics. They've just studied the genetics of it.
Well, I think that they could be equally as impactful. But we've studied genomes. We've studied over 300 African Americans, or self-declared African Americans, and looked at the genotypes. And this is what we found: is that Puerto Ricans in this country have the highest rates of asthma. A Puerto Rican male in New York City is 8 times likely to die from asthma than other males. African Americans next with about 18%. Then Caucasians. Mexican Americans have the lowest rates of asthma. And it turns out if you take the gene, you twist it around, and you look at the various components of a gene, if you have a substitute, 16th position arginine for glycine, you are not as responsive to albuterol. And lots of studies have also demonstrated that African Americans are not as responsive in some instances to inhaled corticosteroids. And so consequently, I think those things have to be taken into consideration when you have a person in front of you who has asthma and subsequently is not doing well. I think the first question you have to ask is, are you doing the things we suggested last time? But then you have to be concerned about these very differences among races in terms of how the manifestations of asthma take place. And so we've studied several, these studies have been looked at Puerto Rico and Mexico and across this country and in the Caribbean, and those figures hold up, that there are more African Americans, more Puerto Ricans and African Americans who have this genetic change, and that's one of the things that results in some of the differences. However, if you look at the numbers, that's what's so disturbing. African American children 3 times more likely to have asthma. African American women have the highest rates of asthma mortality in this country. Every day, 10 people die from asthma, but asthma is a potentially reversible disease. No one should really die from it with what we know today.
And that I totally agree. We lost a cousin when I was I think I was in middle school, elementary school. And because I've had asthma my whole life, it scared me to death. Because you can imagine, I was like, wait a minute, now how did this happen? I have asthma too. How'd she die? And she apparently was having an attack and she was home with her child. And of course, the child couldn't do anything and she collapsed, basically, stopped breathing.
But Dr. Renee, you know that when people get into trouble, they've been slipping in the darkness.
Exactly. Oh, no, I know.
Well, they've been slipping in the darkness for a while. I mean, you'll say, well, doctor, it's a doctor, because, there are basically 2 types of medications. One is rescue medications,
right,
like albuterol, Ventolin. I'm throwing those names out because people may remember those. And then there are the rescue medications. Yep. Okay. I want to see that number. A well-controlled patient with asthma should use one of those a year. If your asthma is well controlled, you're using only one of those a year. That means, and it's pretty clear from all the studies that people who overutilize albuterol do damage to their airway. We used to tell people, if you have asthma, it's reversible. You can kind of hop along, and unless you get way into trouble, you're not going to have a problem. But now we know that untreated, uncontrolled asthma can result in chronic obstructive lung disease in many patients as they get further on. I don't know why we thought that inflammation of the knee that starts to swell and get sore. Why do we think inflammation of the airway would be any different?
Right.
So albuterol is a good drug, but it's a rescue drug. And if you overutilize it, it increases your chance of going to the emergency room, and it increases your chance of dying from asthma. And so that's one dynamic. The other dynamic is that we aren't using the controller medications that we should. We keep that albuterol. Now, I am the only one in my office who can refill albuterol. I don't care if you are visiting your grandmother in Chicago. I don't care if you're standing in front of the Eiffel Tower. If you haven't been to my office the way you were supposed to, I'm not going to refill your albuterol. You can go to the emergency room. I'll tell you where to go. Get it and stay 6-7 hours. But I'm not going to refill it because everybody's got all these fancy tests. These spirometry, pulmonary function studies, and to measure asthma control. But you know how I measure?
Peak flow.
How many albuterol? No.
Oh.
I don't think that's peak flow. How many albuterols are you using per month? That tells me all I need to know. I don't need peak flow meters. I don't need any of these pulmonary function studies, spirometry. If you call me in a couple of weeks and say I'm out of my albuterol, I know one of two things: either you're getting sick or you're not using the controller medicines that we recommended. What's interesting now, though, and I digress a bit, is that now you remember the combination medicines, the Advairs, the Dilaras, and the Symbicorts. All right, now the Dilara and the Symbicort they all have two components. One is a long-acting beta agonist like albuterol. The other is an inhaled corticosteroid. But Dilara and Symbicort have formoterol, and formoterol works every bit as fast as albuterol, except it's a long-acting beta agonist. I would say that nobody recommends you use the long-acting beta agonist alone, but in those products, you can use them the same way you use your albuterol, probably get a better outcome.
Really?
Yes. Well, formoterol and albuterol have the same onset of action.
Okay.
And consequently, if you're using salmeterol and you give the additional bonus of the inhaled corticosteroid, you'll do better.
So I will tell you that. So you guys, I just met Dr. LeNoir, so he doesn't know my history, but my sister ran a half marathon. And so I said, okay, next year I'll go with you. So I thought I was going to do the walking portion, but I let it sell out. So I had to do the running. Now I'm an asthmatic, so this is insane, but I have no choice. Like I said, she's my younger sister, so I committed. So I did couch to 5K, and I did 2 5Ks and 2 10Ks. And then I did the Disney World half marathon. And in that time, I had a pulmonary function test. And the doctor was like, your lungs have vastly improved. I was like, really? And my mother's a respiratory therapist. So I sent her the results. And she said, HIPAA, why are you sending me somebody else's results? I go, no, those are mine. She said, your lungs didn't look this good when you were born. And I've been off of controller meds for 4 years now. I probably go through one inhaler every 2 years.
Yeah, well, I think that you're fortunate. I think there's no question that exercise can improve lung function. There's no doubt about that in patients who have asthma. And I think that the more exercise you're able to do on a gradual basis, the less medication you will need. But I can tell you you're very, very fortunate because most people, even under those circumstances, would still need to use albuterol. One of the mistakes that people make is you say, well, you have asthma. I said, I only have asthma when I exercise. Well, people who have asthma when they exercise usually have poorly controlled asthma manifested by exercise. And so using the albuterol is something they should use on more occasions. But you're very fortunate.
Well, I would start.
It's a real spiritual thing.
Yeah. Well, I started with, I would take my inhaler before I ran because it would take me 20 to 30 minutes to catch my breath otherwise.
Right.
And so I was like, this is painful. I can't do this. So that's the way I started. By the time I got to the first 5K, which is like 4 months later, I had my inhaler with me the whole time, but I never had to use it.
Yeah, well, I
And
think
so that's the way it's been.
I wouldn't recommend that everybody try that style. I mean, but I think that you are fortunate,
Yeah.
and I think your considered progressive use of exercise is something that most asthmatics should emulate, and would result in the reduction in the need for medication.
Yeah. And it was a gradual thing. If anyone knows Couch to 5K, it's a training thing. So you walk, then you run a little bit, and they literally gradually take you up on the running. So I ran the whole 45 minutes that I did for the 5K when I did the race, but today I did 5 minutes on, 5 minutes off, running and walking, and I survived. But so that's how it started. Now I was the person though that could not finish the mile in elementary school. I was the last one and was dying when I got done. And I was also the one that went to the ER every night of April and October because I was having an asthma attack. Remember, my mother was a respiratory therapist, but they were so bad that she was like, we got to go to the emergency room. So,
well, I think that one thing that you have to remember, people who die from asthma are usually not from the severe asthmatic group. They're
I
usually
didn't realize that.
they're because why? If you got people with severe asthma, they got their own machines. They got your machine, my medicine, your medicine, medicine from the ER, cousin's medicine, and when they get sick, they're at your door when you open, because they know how bad it can get. It's that person who has an occasional bad asthma attack. The patients that I have lost, and we had a tragedy, and one of the reasons I went into asthma was I had a wife with very, very severe asthma.
Okay.
And so consequently, that was the genesis for me going into it. But people who have mild or moderate asthma, see, they think they can get away with it because they do most of the time. They get out on a football field or a baseball field, and all of a sudden they have an attack and they have no action plan. And so by the time they get to the hospital, they're dead. And I've lost maybe 4 or 5 patients, all of whom had mild to moderate persistent asthma, not severe asthma.
Wow.
So that I think that you should always, even though you've come this far, you should always have with you an albuterol just in case.
Yeah, I had my own oxygen tank as a child too, and I had a backpack that I carried it on.
Yeah.
Mm-hmm.
Now that's serious.
Oh no,
That's serious.
but it was that bad. It was horrible.
That's serious asthma.
It was horrible. I'll never forget. We went to the Janet Jackson concert, and me and my dad got stopped because I had my breathing machine with me. And because every time I would get excited, I would usually have an attack. And well, obviously, I'm at Janet Jackson's concert. I'm going to get excited. Therefore, my parents were like, we just need to take it with us.
But there are some other issues that are associated with that when you have repetitive asthma as a child, because there's a certain anxiety component that you're about to, like I say, slip into darkness. And and you start to breathe fast, and all of a sudden it feeds on itself. But it sounds like you had more of a pulmonary problem than most.
Yeah.
Most children who get asthma early on only have it with infection. And by the time they're 4, 5, or 6, they don't have it anymore.
Right.
Subsequently, maybe as adults, they may be more likely to have adult onset asthma, but it's not been proven so much. So that only about 7% of children go on to have allergic asthma or persistent asthma. So you were already in a group that was, and where'd you grow up?
Farmington Hills, Michigan, suburb of Detroit.
That explains it. No, that doesn't explain it. But most children who have asthma usually have outgrown it by age 4, 5, or 6. Those that continue to have it do have the kind of severe asthma that you manifest.
Yeah, and I have the food allergies. I had allergy shots as a child, so the environmental allergies I don't have a problem with, but I am still very allergic to more than the top 8. So we'll just leave it at that. But yeah, I'm allergic to a lot of foods.
Well, there's a lot of interesting studies now that I would like to share with your audience about the whole manifestation of how asthma develops. There is a cascade of diseases that you can get called the atopic march. So it starts with little kids who have eczema. And if you have eczema, you would think that if you're going to develop food allergy, it's because you're eating these foods. That's not the way it happens. What happens is eczema is a barrier disease. So that means there are breaks in the skin. And so that when you have peanut allergy or egg allergy or wheat allergy, then it gets through the skin into the system that then goes on to result in other diseases. So first there's eczema, then there's food allergy, then there's allergic rhinitis, and about 4 or 5, then that's when asthma starts. So that we know a lot now about foods and its relationship to asthma, particularly peanut. Peanut, is a food that we've learned how to live with, and we've learned how to integrate into infants' diets such that they won't have the problem. But when you talk about food allergy and asthma, then it often starts. It often starts, as it seems to with you, when they're small children. Generally, though, with asthma, there are only two foods that survive. It starts with egg and milk and soy, but the two foods that survive are the seafood and the nuts that survive into adulthood and can trigger asthma attacks. One of the saddest things I have to do, two sad things. One is to tell somebody to get rid of these animals. I don't like animals licking on me and running around. I'm not a big animal. I don't want them on coats or experiment on, but I don't understand why asthmatics let them live there like children while they're causing particular problems.
And the people that know it, that's what blows me away. You know you have an allergy to cats and you have 10 cats.
Yeah, I don't want them. I don't want cats and dogs around. I'm just not that person. The other thing is, the saddest thing is to tell people who, many of them from Louisiana, Texas, and the coastal North Carolina, that you're allergic to seafood. It's the saddest thing that happens in the office. I've seen them almost break into tears, but seafood and nuts are the two foods that tends to survive and continue to cause asthma as foods.
Yeah, I am still allergic. I'm allergic to all nuts and seafood. I can't smell seafood cooking even. I'll start wheezing.
Yeah.
And that has, like you said, survived. Also, I wanted to say there's a couple people that said their asthma is not controlled by listening to what you're saying.
Right.
I think could you please stress to people how important it is to go to a physician in your specialty and let you treat the asthma rather than their regular primary care physician?
Well, I would say that there are some primary care physicians with an interest in
Right.
asthma. But if you're going along on the normal protocols, starting with the avoidance of the things that make you wheeze, starting with increasing your exercise, starting with using of short-acting beta agonists as rescue medicines only, using the long-term medicines, those that are inhaled corticosteroids. And now we have several levels above that in ways we can treat asthma. There's the introduction of the biologic Xolair, which we have had for the last 10 years. And now there are all new kinds of biologic for severe intractable eosinophilic-based asthma. So there are lots of things that can be done. But too often, doctors let you live too long with wheezing. If you're wheezing, first of all, that means you have 70% airway obstruction in the area where you're wheezing. A little bit of wheezing doesn't mean a little bit of asthma. A little bit of wheezing means an awful lot of asthma. So if you're coughing and you have to use your inhaler more than 2 or 3 times a week on the protocols that you're on, then you really need to talk to your primary care physician about that. And if that doesn't work, leave and go somewhere where you can get a more experienced opinion. Pulmonologist, allergist, even a primary care doctor with a specific or provider, because nurse practitioners are just, I think, in many instances, and respiratory therapists know as much about it as we do. But go to someone who knows who has lots of experience with it, because you can't just stop at albuterol. You can't just stop at drugs like Qvar and Flovent. Then you can't just stop it now at Zoloir. Combination products like Symbicort or Advir or Dulera. You got to move up to the next level, which then is Xolair, or move to one of the biologics. So there are all kinds of ways to treat asthmatics. I haven't had an asthma patient admitted to the hospital, with the exception of small children with respiratory syncytial virus, in a very long time, because we work together. It's a shared decision-making issue. But you have to get some, I don't care what you're talking about, asthma or diabetes, don't let your cousin take care of you. I'm telling you, you better get somebody who knows what they're doing and has a reputation for knowing what they're doing.
Right.
I think because of what we, as African-American physicians, have to handle. In the Bay Area, I take care of the sickest group of patients in the system, because some of them are underprivileged and underserved and living in housing and with gun violence and all these other dynamics that are often, pushed on as causes of asthma. So I have a great deal of experience with taking care of people. I also have a great deal of cultural experience.
Right.
So I know when you're not telling me the truth. It doesn't even take me a minute. Dr. LeNoir, I said, have you used the Dr. LeNoir, medicine you gave me was just the greatest medicine in the world. And you look into the electronic medical records, they haven't filled that medicine since 1947. So that's not the truth. I mean, so there's a certain cultural thing that has to take place and understanding how to talk to people about chronic disease. You can't make the decision for them, and you shouldn't try. But you can show them that under certain circumstances, you could be better. And this is the way I would suggest for you. But if you want to do something different, as long as I don't end up on the front page of the paper, I'm fine about that. But I think there's other things that we have to also think about: acupuncture and acupressure, meditation, spirituality. All of those are tools and techniques that you can integrate into an action plan for patients with asthma. No patient with asthma should be in the emergency room anymore with all of the things that can be done.
Right. I totally agree. A couple people have mentioned mucus. So let me just tell y'all my take on mucus. Dairy is really scary. And mucus, when I tell you I gave up dairy and all of a sudden I didn't have to clear my throat anymore, I was like, oh my God, there's like no mucus in my body, I don't think. So, can you talk about mucus and asthma?
Well, if you look at, I hate to go back, if you look at autopsies on patients who died from asthma, it's usually from mucus plugging. The mucus that asthmatics make is a bit different from the
Right.
mucus that you get from drinking dairy, because what it is, it's down deep in the lung being like an inverted Christmas tree, and the problems with asthma down in the small airways. Then they get plugged with this certain kind of thick, tenacious mucus created by these inflammatory cells, and so consequently, mucus production can really be a big detriment in appropriately caring for a child or an adult with asthma. So I do think that I think that you're right in terms of some of the things that cause upper airway problems. I think what people don't often recognize is that the upper and the lower airway are connected.
Mm-hmm.
So if you've got asthma and your upper airway is not clear, you're not going to be able to appropriately handle the lower airway. So we see it as one airway, one disease. So taking care of the upper airway mucus, chronic sinus issues, those allergic rhinitis, that's all important. But the mucus production that you have in the lung is somewhat with asthma somewhat different, but it develops gradually. So that if you are starting to increase, I just can't tell you. When I've seen people admitted to the hospital or really sick, I think what a pity it is. They didn't take better care of themselves because they didn't have to be there like that. Now, one of the problems we struggle with is that there are not as many specialists in African American and underserved communities. I mean, I came to this community by choice. Everybody's always welcome in this particular practice. But I think you have to look a long way for a black pulmonologist or a black allergist. But I think what's going to happen though is the more you know about this illness, the more you understand what we call even the basic physiology of the problem, pathophysiology of the problem. The more you have an action plan, the better you will be able to handle your asthma. And at the end of the day, I think you're going to find that if you do those things and you throw in some spirituality, some meditation, perhaps some acupuncture, some other Chinese herbs, whatever you choose to use, I think that there is a way to craft together a formula for almost every patient with asthma such that they have the ability to handle the problem themselves, because so often the system is not patient.
So, with the onset of telehealth, would do you see patients that are not in your area?
Oh yeah, we see patients all over the country. Well, California's a little bit different from a lot of states.
Okay.
Almost everybody in California has a health plan. I mean, there's almost no independent health plans. Now we're not set up yet for telehealth, but maybe with blackdoctor.org we can make that happen. But I do think that the telehealth has shown us that you can do a great deal of good just by looking and talking to people, and you don't have to. Let's face it. I mean, doctor, you and I both know that a lot of what happens in the office is just theater. I mean, you just go in there with your stethoscope. And the last time I went in with a stethoscope and heard something that I thought didn't suspect from the history, it's been a while. Now they got chest X-rays, EKGs, and all of that. So that just talking, what I like about telehealth is I've had better conversations with my patients since with telehealth than I did when they were in the office. Because let's face it, you got 20 people waiting outside to see you mad because you're about
Yeah.
10, 15 minutes late. You're not going to give the same kind of time. So I appreciate telehealth. And I think people who are not, here's the danger of the coronavirus epidemic, is that people are going to ignore some of the screens that they need to get, the mammograms, the cancer screens, the regular visits to the doctor. some of the necessary surgery, so that you can't, and then people are going to forget that they have to eat right and exercise and do stress reductions. And so I think that you have to decide for yourself that you got to know the most about this disease because I have it. And then you're going to use the healthcare system as tools in your toolbox to make sure that you're not in the emergency room, a hospital, and your children are not suffering unnecessarily.
Yeah, definitely. And so I think that if and I think a lot of people don't pay attention to the action plan, but it's really, really, really important that you pay attention to the action plan because you can figure out something's happening before it gets too bad. And once you get too far gone is when, like he's talking about, that's when you end up in the hospital and that's when people end up dying. So you got to make sure you follow an action plan and oh, okay, something's happening here. I need to watch this. I should double up. I was on Advair. That was the last medicine I took. So we had an action plan. So when my peak flow or when I didn't feel right, he was like, okay, you need to take that one instead because that one's 500 and not 250. And you take that one and then call me and see if you get better or whatever. So we had a plan and I knew what to do. And so, not to mention I'm a medical doctor, obviously, but I knew what to do. And I'll tell you, my allergist, may she rest in peace, Dr. Marva Morris was a Black woman. She went to Fisk University. She was my allergist as a child, and she knew, because I always wanted to be a doctor. So she knew as a child I wanted to be a doctor. And she would sit there and treat me like I was the doctor. She's like, so what medicines are you going to take? Because some of those past medicines, like inhalers, were horrible, tasted terrible, ruined your food. And so I would tell her, well, I'm honestly not going to take that. So can we figure out something else?
Well,
and she was, she was great. And she got me through until I graduated high school and moved out of the house. So, yeah.
Well, no, I think that you set a good example is that you have to know your disease. I mean, that's the big problem with asthma. We see too many people who are poorly controlled because, and here's the other thing, anytime you have a chronic disease where you don't feel sick all the time, it's tough. Now, I got this, my wife gave me this great case for me to take my hypertension things and cholesterol and stuff. They laid it out from Monday through Saturday. Sometimes I look up, I miss Thursday, Tuesday, because it's very difficult if you have to take something all the time.
Mm-hmm.
So my consideration would be this, that, if you're going along okay, try to do what you try to do. But the minute you start to feel a little differently, the minute you start to be coughing a little bit more, because that's usually the first sign, the minute you start getting short of breath or find yourself using your albuterol, you need to go back to your action plan. I've traveled most of the country, lecturing about asthma. And in some states, the action plan has to be signed by the doctor.
Wow.
It's developed by nurses at school for children, developed by nurses at school, and then the doctor has to sign it. One of the things I hope we don't do, because the emergence of a new medicine across the counter called Primatene Mist is one of the most dangerous things to happen in America. Most albuterol rescue medicines are primarily, there are two receptors in the body. One's an alpha receptor, one's a beta receptor. The beta receptor opens up the airway regardless of what closes. The alpha receptor has to do with heart, lung, and other things. So that the Primatene Mist is both an alpha and a beta drug. It is a dangerous drug for people to use for asthma because it is both an alpha and a beta drug with much higher side effects. So if you're going to use a drug, make sure that you're using albuterol. Because it's by prescription, and your provider can follow and see what you're doing if you will let them. But I do think that people who have significant asthma have learned to kind of deal with some of these things themselves and might not know that there are treatments above the level of the combination products like Dolera and Symbicort and
Advair.
yeah. So there are new techniques, there are new medicines, there are new ways to look at asthma. But I do think that you're absolutely correct. You need an action plan, and you need to stick to it when things start to go wrong.
Definitely. And that Primatene Mist, I was going to mention that earlier. So many people were just taking, buying that over the counter and not going to the right doctor to find out exactly why do you need to use that.
Right.
And that I think is a huge problem.
And I think, one of the things that I think is certainly culture for us is that, Black women tend to keep pace. I mean, they tend to keep up with things. I mean, my family, when they need mammograms and doctor's visits, they're right on time. Me, I'm trying to figure out, well, maybe next Friday, because most black males, we don't want no bad news. Things are going good. I'm feeling good. I don't want nobody to give me no bad news. And we see the worst asthma in black male adults than we do in any other ethnic group, although we see more deaths across the country in women because they actually are taking care of themselves and get counted. But I think my message to any black males who are listening with asthma, I mean, you really need to get into the system where you understand your disease. First of all, you have resources. You've selected those resources carefully, the doctors, the hospitals, the providers. You know the various stages of your problem. You know what your medicine is supposed to do, and you have them. And so, consequently, if you do that, I can guarantee you the quality of your life will improve substantially within the next month.
And then I think also the other thing is a lot of people don't realize the allergies that they do have that are causing them the problems that they have. Because yeah, people say exercise induced, okay, but then there's also, your environment. You didn't realize that you were allergic to whatever kind of dog, and you have this dog, and yes, you've had him forever. Or things have changed in your body and you weren't allergic before, but now you are. I had a friend that was diagnosed with the allergy to peanuts, but she didn't know that that strange sensation in her mouth every time she ate peanuts was an allergic reaction.
Yeah, no, I think there's no
I
question.
have my whole life. I as soon as something hit my tongue, I can tell you, oh, something in that I'm allergic to.
I used to say this that somewhere in medical school, you believe in allergy or you don't. And if you don't, it's an irreversible decision. But I can tell you, as an allergist, one of the things that I have my practice was somewhat unique because I was an allergist for 5 years, and then in the places where I practiced in Oakland and San Francisco, people needed all kinds of primary care. And to be an allergist, you got to be a pediatrician or an internist
Yep.
at the same board. But so I had a pediatric practice for a very long time and an consulting allergy practice for a very long time. And I can tell you that there are just differences in how you care for people if you know something. And so consequently, I think that you're right when we talk about trying to put together these plans and getting the right people in your life.
Yeah, and I did an asthma focus group for some. I forgot what the treatment was. It was a new treatment that was coming out, and I was sitting there, and all these people were talking about how they miss work and all of this stuff, but none of them were seeing an allergist.
Right. I think that most of the time, like I say, people believe in allergy or not, and we know from just common sense that there are various things that cause people difficulty. We can intervene with a much better environmental control program, but you have to be careful, Dr. Renee. You can't tell a person. House dust is one of our major allergens for any asthmatic or patient with asthma. But you can't tell them that, you got to tell them that the room can be clean, but not dust free. Because if you tell them dust is a problem, immediately, well, I keep my house clean. Uh, but I think there are certain allergens like dust and animal dander, which are particularly difficult, mold in some parts of the country that are particularly difficult. And if you're not paying attention to the environment in which you live, work, or sleep, then I think you're going to have more trouble with your asthma than you should. So you can identify it by just asking yourself, do these things bother you? And then taking the steps to eliminate. If you don't want to go to the allergist to learn, go to YouTube. I go to YouTube for everything else. I go to YouTube and look up dust proof in a room. And those of you who are listening who have asthma and have an allergic component to it, if you look at one or two of these videos and you do some things in your bedroom, it's going to increase it's going to impact your asthma by at least 30%. And so consequently, I think allergy is an important component. And if you don't know whether or not things are bothering you, well, let me say it differently. You know what's bothering you.
You sure
You
do.
you know that cat. Every time that cat gets in your lap, you start wheezing and coughing. You don't need a genius. I don't have to be a rocket scientist to say this cat is not a good thing for me. Or if you go to bed at night and you don't have pillows and mattress covers, the dust bothers you. You know that certain mold bothers you, and you know what other circumstances. And so consequently, I tell doctors that if you take a history from a patient with asthma and you have no idea what they're allergic to or what might be triggering their asthma from the history, then the skin test shouldn't be done. They will merely serve to confuse you. You'll get false positives, you'll get other things. But you can get most of that information if you talk to yourself about what bothers you and what bothers your asthma. You make the necessary steps to correct the immediate environment, and you put together an action plan based upon at least some control of your diet and control of those things that you know trigger you. In those instances, if you want specific information, or if you want to understand the allergic component or see what can be done about that piece beyond the environmental controls, then I think allergists would be the place to start.
Yeah, definitely. Also, I wanted you to talk about, I know, and I just lost it. Let me see if it's in my notes. I just had it.
Just come to us in your own way. Take your time.
Yeah, Lord, it was good too. But somebody mentioned, oh, could you talk about allergy shots? Because there's a lot of people who are like, well, I don't want to give my child those, but I found them to be very helpful because when people talk about not flu season, but people talk about sinus issues and stuff, because of course we're here in the Midwest. People have all these different fever, hay fever and stuff. I don't have those problems.
Well, allergies break down the potential triggers in inhaled and non-inhaled allergies. Inhaled allergies are gases, trees, and leaves, and to certain extent, some elements of and non-inhaled allergies and food, drugs, and insects. And so we're always looking for those things. And I think that when you start to talk about the three components of taking care of your asthma from an allergy perspective, we're talking about the environmental controls we just talked about. We're talking about medications. And then if those two fail, then we talk about the various forms of therapy. And it's not just immunotherapy, as you remember. Certainly there are the allergy shots, that's called subcutaneous immunotherapy. It is designed to give you graduated doses of the medications over a period of time to get some kind of a tolerance. The simplest way, probably not the most accurate physiologically, is the simplest way to understand it is it builds a blocking antibody, a different way for your body to look at the things that are bothering you. It's very successful for pollens, for house dust, for mold. It's not successful for foods, or drugs, or insects, or certainly not for bacteria. But for pollens, animal dander, house dust, it's excellent. But then there are other forms of immunotherapy. There's subcutaneous immunotherapy. In fact, in Europe, all they use is subcutaneous immunotherapy. That is the preparation that's put together so that you can put it under your tongue on a daily basis. You don't have to go in for the shots. Then there are other forms of gradually, especially for foods, gradually introducing small bits of food over time to see if you can reduce the stimulus of food on your asthma problem. I mean, if you look at peanut, for instance, we now know that children who are allergic to peanuts, who have asthma with peanuts, are in a different group. So that if you have a sibling that has a peanut allergy, and you have a baby after that, you want to give that baby some exposure to peanuts before the age of 9 months. And then you can reduce the significance of any allergy problem that child was subsequently going to have, because he too would have a problem with peanuts. So challenges in gradually oral immunotherapy, you give a little bit at a time, is another form of therapy. So there's subcutaneous immunotherapy, that's classic allergy shots. And it's not forever. I mean, pretty soon in 28 shots, you should be on every other week. And then for a year, then every once a month. It shouldn't be forever. 3 years is the maximum. The time we will keep up shots. However, some people don't want to stop. Subcutaneous immunotherapy in this country is only available for two antigens, house dust and grass. So consequently, if you have to get a tree, Amyldander, something else you may as well grab those subcutaneous immunotherapy. And now we have very rigorous templates for challenging for food or oral immunotherapy by giving gradually decreasing doses of certain foods to reduce your sensitivity to those. I think that you lose those criteria in your mind. You've got a disease that's significant, and in point of fact, medical therapy and environmental controls have failed. Then that's when you consider immunotherapy. Any allergist or any doctor will talk to you about immunotherapy before you get a chance to change your environment, before you get on the right medications. You should kind of stay away from.
So, Dr. LeNoir, did you do something? Because all of a sudden you sound really robotic.
I sound really robotic.
Yeah, everyone was having trouble hearing you.
Oh, I'm sorry. I didn't change anything. Can you hear me now?
It sounds the same.
We didn't change a thing. I haven't moved.
I don't know what happened.
Let's see. No, I haven't. Let's see. Can you hear me better now?
No.
No. How about now?
Mm-mm. Okay, now we can't hear you at all. You're muted. Oh, it went away.
All right.
Praise
I
the
think
Lord. Okay.
you're dealing with a technological genius there. But go ahead. But I think that I said, and I hope people heard me, that if in fact you go to an allergist or a primary care doctor and they do a set of tests, and the first thing they suggest is immunotherapy, you need to walk away.
Gotcha. So I'm so glad I've read the comments and I've seen a lot of people said they didn't realize how important the action plan was. And so we have definitely made sure that they understand that, which is great because I'm telling you, the action plan will save lives. My mother, she was not joking, but she's a respiratory therapist, like I said. So she was not joking, but she said, Renee, if you play around with this, it'll kill you. And, and she was right. I needed to, I needed to know exactly what was going on and make sure I did something when it was. So I do, of course, I have a breathing machine and stuff. And so when I know that I don't feel right, I take, I double up. I start taking meds again because I don't take them now. I start taking Advair, and then I'll take breathing treatments if I have to, because I need to make sure that I'm back to normal.
I would recommend that you switch from Advair to one of those two drugs that has formoterol as a long-acting beta agonist, because it will act at the same degree of efficiency as albuterol. Okay. But I would like for people to remember a couple things. Every year in this country, 10 people die from asthma. Every day, 10 people in this country die from asthma. And fortunately, there's no greater risk to asthma patients from the COVID virus than for anybody else. So that if you have asthma, you're not at any greater risk for COVID infection or for the impacts of COVID infection as anybody else. But remember this, people who die from asthma are not usually the severe asthmatics. They're usually the patients with asthma who have mild to moderate problems, who get into trouble and have no action plan.
Thank you so much, Dr. LeNoir. I think this has been a great conversation. Let me make sure that I review real quickly. I think. So what is your take on medical cannabis and asthma?
Well, there was let me tell you a story. My dad was a YMCA exec, so we moved around. I ended up in New York, but before we did that, he came from the Smoky Mountains. Everybody that waves at you in the Smoky Mountains, black person from the porch, is related to me in some way. And when I was young, your age, I had asthma as well. And so my grandmother believed in two things. She believed in nailing your hair to a tree, and when you grew past where that nail was, your asthma would get better. And so that, there are journals that supported her because that's true. But then when I got sick, first of all, I didn't want to be down there. My brothers went D.C., going to Smithsonian and these other places. And here I am in the Smoky Mountains without houses and the whole deal. All right, so when I got sick, I would be real dramatic. I mean, like I would call my mother, I want to go home, So my grandmother would go to the cupboard and get something called Green Mountain asthma powder. And all of a sudden, everything kind of calmed down. My uncles kind of started talking about the crops, and my grandmother started talking about the war, and I started getting better myself. It turned out that Green Mountain asthma powder is 100% pure marijuana, sold in the Smoky Mountains as Green Mountain asthma powder. So, and then in 1984, the New England Journal came out with a very heavily resourced article that said that the marijuana was a very potent bronchodilator. Now that's changed somewhat now, but that was what would happen. And my grandmother did not get one credit in that New England Journal article.
Okay, well, I see. Interesting. I know what I wanted to ask you. Why is it that people always have asthma attacks at night?
Well, because when you're recumbent, then I think a lot of things pool up in your lungs and acted not only as obstructions, but also as irritants. And the other thing is that so many people are allergic to house dust and other things. And even though their rooms are clean, if they got a lot of items in there, they're not dust free. And so I think that many people are listening to us. If they would just, like I said, go on YouTube and look up dust proofing a room, and you get a pillow and a mattress cover and remove a lot of items from the bedroom, kick out that cat or dog who shouldn't be in there in the first place.
I have an air cleaner too.
Yeah, well, yeah, that it can clean large particles, and that does help. The right filter, like HEPA filter, will help too.
Right.
But if you do those two things, you're going to notice immediately some improvement in your symptoms. And so I think that's one of the things that I think everybody should be concerned about.
Yeah, I actually, when I slept when I was younger, I used to sleep on like 7 pillows. I never slept flat because
because you were poorly controlled.
Exactly. So I was having issues. So now I sleep flat as a board. I don't need a pillow at all.
Yeah, well, I think if you find yourself having to sleep upright, then you need another step in your treatment. I can't overemphasize the fact that most of the patients that I have seen in consultation had no idea of the other things that could be done for severe intractable asthma. And so I think it behooves people who have these problems, especially African Americans, because they don't want to talk to you anyway. The staff doesn't want to talk to you, and they call you by your first name. They want to talk about other things, and they don't always give you the information that you need. So if you have a chronic disease that's not just asthma or diabetes or heart disease, you have a list of your agenda when you go to see the doctor, and you ask them about these things. What do I need to be doing for these various and sundry problems? And so I think that that when we go back to the original question, I think that at night when you're lying flat, then that's going to be a problem that tells you how well your asthma is.
This is true. This is true. Well, this has been, I think, very informative to me and to many. And so thank you so much, Dr. LeNoir. I appreciate you giving us your time this evening. Everyone, this has been blackdoctor.org. You can keep typing questions in the comments, and hopefully we'll be able to get those answered for you. And everyone have a great night. Bye.
Thank you for the invitation, Doctor.
Oh, you're welcome.